All right, three, two, one. Hello, welcome back to the Bleeding Truth. I'm Sally McNally, the Irish midwife.
And I'm Bridget, Sally's daughter.
This podcast is all about women's health and my own personal stories working as a midwife in the labour room and outside of the labour room.
So please like and subscribe and hit the notification bell so you don't miss out on any of our episodes. It's completely free and it helps us out a lot.
Today is a bonus episode, which isn't going to be the same as our usual story time.
Yeah, so we're actually going to try to show a clip and describe it for listeners. You can also watch our video feed on YouTube too. So there's two ways to see this podcast. But we're going to show the clip of Sally from the workplace in her full scrubs, holding a placenta as she's describing it. It's a very educational video, but it is kind of bloody also. So listener discretion and viewer discretion is definitely advised for today.
So the video you're about to see is me describing a placenta with a very interesting cord insertion. Usually the cord is inserted into the placenta, the body of the placenta itself. This is a rare placenta where the cord is actually inserted into the membranes, and it only happens about 1% of the time. So when we see it, we all get very excited about it.
Right. And this was just from yesterday too. So it's fresh and we want to put it out there and share it because it's just really cool to see if you've never seen a placenta like that before, but also to hear about this type of a scenario as a possibility. So that's really the reason for showing it. So if you're listening right now and you want to watch the video later or stop right now and go watch it, we will put the link in the description below for you to go watch the video and this whole podcast as well. So great. I think we're ready to get rolling then.
Yeah, great.
All right.
Today we have a very interesting placenta and cord. So it looks lovely and healthy. You can see blood vessels coming through it. It's lovely and strong and thick. But when we look down at the membranes here, we can see that the cord actually didn't insert all the way into the placenta, but into the membranes. And when we open up the membranes, we can see these blood vessels running through the membranes. So this is one of the reasons why we never pull on a cord when we're delivering the placenta. We deliver with the help of the mom pushing down, and we deliver it very slowly, very gently, because this could break here, and then of course there'd be a little bleed. But also this is a very lucky baby. If the membrane had ruptured around this area where the blood vessel is, that could have ruptured that little blood vessel, and there could have been a severe accident. So these are the things that keep us awake at night when we work in obstetrics. But a very interesting one, so just didn't want to let that go without getting a good look at it. Called Velamentous Insertion. This is quite a ways away. So this is lucky baby, and the baby also has a cord wrapped around their neck twice. So we all want to go to Las Vegas with this baby. So very interesting, huh?
Wild. Yeah.
Yeah.
So what is the dangers of this type of placenta for the pregnancy?
Well, there's danger, say, for the baby. Those blood vessels that are going through the membrane, if those ruptured, when the membrane ruptures, sometimes a little hole comes when it's time to, be born. But if that little hole came around where the blood vessel was, then that blood is coming from the placenta, from the cord, from the baby, right? That's the baby's source of oxygen and nutrition. And the baby would be in a lot of danger.
Okay. Wow.
The danger to the mother when we're delivering the placenta, of course, the baby would already be born, but when the placenta is coming out, if we didn't know that there was a little problem with that, then any kind of like little chug or pull on that cord, it could rip away, and then the placenta would be left inside. Um, and maybe we'd be able to get her to help push it out, or maybe it'd be easy enough. But sometimes if that happens, she might have to go to the operating room to get something to help her relax and sleep while the obstetrician would reach up there and
Oh wow.
take it out. Yeah,
Oh
or
wow.
we might do it as well. But yeah, it could be very dangerous situation if you weren't aware of it. And of course, it's very hard to diagnose that, especially in the third trimester. The last few weeks we might be doing ultrasounds to make sure that the baby's fluid level and growth level is good, but it would be hard to see something like that. And that was a really severe one. Usually if you see something like that, it's only just a little minor one where the cord is very close to the placenta, and not as risky. That one was very
Mm.
risky.
Oh wow. At what point during this pregnancy or delivery did you realize that it was like an emergency situation?
Well, the baby was born without any difficulties. Baby did have the cord around their neck twice, but it wasn't tight. It was all
Wow.
really easy. Baby came out. Baby was fine, shouting, looking around, um, saying, "Where am I? What's going on?" But so the baby was fine. And then as we delivered the placenta, of course, the mom was wonderful. She pushed down while I braced her uterus back with my hand over her abdomen, and she just pushed it out. And there wasn't any real difficulty because, of course, I wasn't pulling on it. She was
Right.
doing all the work. I was just guiding it as it came out. Yeah, but as it came out, it did bleed a little bit more than usual and in a different way. And I was suspect of something. But we always check the placenta and the membranes and the cord right after. And the parents are usually really interested to see their placenta. So we were looking at it, and I showed them the blood vessels moving through the membranes, and told them how lucky the baby was. And it was quite an emotional moment for them,
Wow.
to see that and to know their baby was safe and sound.
Yeah, it sounds like really lucky that it went smoothly. Like it could have gone wrong
Yeah, yeah,
fast. Yeah.
but it was
Wow.
fine.
Yeah.
Yeah. And then that makes it even more exciting, So the placenta is like an organ all of its own. And so it's very interesting. You delivered the baby, and then the body expels this organ. Body's like, don't need this anymore. Let's get rid of this. And that's what a placenta looks like. So sometime I will show you a placenta that's like an average, everyday kind of placenta.
Hmm.
That one was just a little more interesting, and that's called velamentous insertion.
Okay.
A velamentous insertion. Now, sometimes there can be this added danger called vasa previa, where uh, those blood vessels moving through the membranes could be down in front of the baby's head. And that, of course, is where the membrane we think usually ruptures, somewhere there in
Mm.
front of, and then there's a little added risk. Now, if that was diagnosed beforehand, then that vasa previa often leads to a scheduled cesarean section. Just would be safer option than risking rupturing the membrane and then having a bleed before the baby was born. I hope that makes sense.
I wish we could see the normal one too
Yeah,
to really get a
I
feel for it. So maybe
yeah,
we'll do another one soon,
yeah,
similar.
right.
Um, for
I
you
did
guys,
get the parents' permission to
right,
post that.
right, of course. But for you guys listening and watching, since we haven't done a episode kind of like this, like more real time stories, if you're interested in that, please let us know, because we'll probably try to mix a couple more of them in if Sally gets, cool situations like that, which she has the permission to share, because we enjoy this stuff. So if you guys like it, please let us know as well.
Yeah, great. So thanks for listening today. And if you have any questions, you pregnant ladies, I don't want you worrying about this. Remember, there's only 1% would have this type of situation. So you're most likely in the 99% part. So try not to worry.
Yes.
Big deep breaths to baby.
So if you have more questions for Sally, we will definitely put that link in the description below for you to ask, and we'll answer them in some of our future episodes as well. Thank you guys so far for having really great questions. There's a couple that we're excited to catch up on this next couple episodes, so stay tuned.
Thanks a million for being there.
Thanks a million. Don't forget to like and subscribe. We'll see you in the next one.
Bye.